On Capitol Hill yesterday, health experts said rebuilding American confidence is really the key to reopening the economy here. But a new CBS News poll shows that most Americans think the government's efforts to contain the outbreak is going badly. Only 39% of people polled think it's going well, and even fewer think things are better now compared to last month. So Dr. Ron Elfenbein is an emergency care physician and joining us now. So you're really on the front lines, doctor. You see what's being done and what sort of support is being offered to hospitals. Could there be more support coming from the government?
Well, good morning, everybody, and thanks for having me back. Before I get to your question, I just wanted to say, when you had me on a week ago, we talked about those intubation boxes that we've been getting out to hospitals and emergency rooms, and I just want to thank you because we probably had 20 people reach out to me to ask for more. I'm going to just give that website one more time. It's helpthefrontlinesmd.com, and all you have to do is just click on that. Anybody out there who wants an intubation box, it's a plastic box that fits over patients when we go to intubate them, and it keeps the viral load down to a minimum, so it really helps protect the people in the room during that procedure. So I just wanted to say thank you, first of all, for helping me get those things out to people. With regards to your question,
that's great.
Yeah, thank you. I'm very, very pleased about that. With regards to your question, I think you got to look at the government. All levels of government have really dropped the ball here, and it's been on multi levels. The government response tends to be slow and bloated and cumbersome, and the larger the government, I think, the slower and the more cumbersome the response. And you look at a couple different levels here. First of all, preparation. Were we prepared for this? No, not at all. And there's totally inexcusable that we were not prepared, both on the state, federal, and local levels, that we were not prepared for this. We didn't have a stockpile of N95 masks. We didn't have a stockpile of ventilators. We didn't have the PPE that we need, the gowns, the gloves, the masks, everything. It's inexcusable that frontline workers are in New York City wearing garbage bags instead of the proper equipment that they need. So that's first of all. Second, you have outsourcing. So we still can't get enough PPE because all this stuff is produced in China. So I would say that this is a national security issue, and the government should really be making sure that this stuff, that there is no compromising of the supply chain when it comes to gathering stuff that are in the interest of the national security of this country. And I would argue that things like this N95 mask, is absolutely in the national security, national interest of this country, and that needs to be safeguarded and needs to be produced in the United States. If you look at history, right? History gives us a lot of information. 1918 is a great example. So we knew that there was going to be another pandemic. We just didn't know when. So it's inexcusable that we were not prepared. We have the playbook. We have the other team's playbook. It's like being in the Super Bowl and knowing what the other team is going to do. We know exactly what worked in 1918. We know exactly what didn't work in 1918. So we should be implementing what worked back then. And it's not, you don't have to be a rocket scientist. You don't have to guess. One of my favorite philosophers, German philosopher Hegel, he said, what we learn from history is that we learn nothing from history, which means obviously that we keep repeating ourselves, we keep repeating our mistakes. And we really should stop doing that because it's stupidity. So what do we know from 1918? Well, we know that the second wave was deadlier than the first wave. Okay, we know that. We know that cities like Seattle, which implemented really, really steep lockdowns, and they were really good about getting people locked down for about 5 weeks. They gradually let people back out. They gradually released some of those lockdown procedures and things. And then they started to see an uptick in the numbers just like everybody else. But what they did, which was key, was they did source tracing. So everybody who got sick, they isolated, they quarantined, and then they traced every single person that came in contact with that person. So what are the keys going forward? Number one, we now can test. They couldn't test back in 1918, but we can. Testing and source control, and then, of course, vaccine development. And I think that's where the government needs to spend its time and its money. Those two things, source control, testing, and then vaccine development.
Dr. Bright is expected to testify that if the response is not ramped up, 2020 will be the darkest winter in modern history. Those are some very, very chilling words. And I see images as states start to gradually reopen and you see people rushing to bars and to restaurants and to gyms. And just taking off my journalist hat for a second, as a fellow American, I'm worried about my fellow citizens because I don't know what this is going to look like in 2 or 3 weeks. I mean, do you think that as these states start opening up, that this rush to recongregate with people in areas that, frankly are not essential? I mean, gyms, I go to the gym, before this, I went to the gym every other day, but now, I do my push-ups and sit-ups in my living room, and I'll probably be doing that for quite some time, even if the gyms reopen up here. And I'm just worried about what that could mean. Could we see in 2 or 3 weeks, as these states start to reopen, that we start to see levels rising again? Or could we not? I mean, that's what the president often says, and I'm going to ask Major Garrett about this. He often says, well, it could be really bad, or maybe it won't be.
Well, I mean, I think there is some truth to that we don't know, and everything that we've been basing our response on is on computer models, which have been proven to be wrong and time again, or at least overblown or underblowing all the information. So it's very hard to kind of cut through all that stuff. But again, I go back to what I said before, is if we look back to what's been done in history, which, again, why we aren't learning from ourselves from 100 years ago, what happened? Well, they opened everything and they got a second wave. I mean, I think it's inevitable. That's my personal opinion. Do I have data to support that other than historical norms? No, I don't. But I do believe that, as you suggest, if we start opening things back up again, then the people are going to start spreading it and start getting sick. And this, I would tell you that coronavirus is actually more concerning than influenza, because if you get influenza, you have influenza because you feel terrible. So you isolate yourself, you stay home. Whereas coronavirus, we know that a certain number of people are asymptomatic, and even the people that have it could potentially get not develop symptoms for up to 14 days. And all that time, they're still able to spread it. So, this is concerning because that makes the infectivity rate so much higher than influenza.
Doctor, thank you very, very much, Dr. Elfenbein, for, as usual, bringing some clarity to a subject that is very, very complicated. We appreciate it. Thank you. And thanks.
Thank you.
I'm very happy that you are getting the response that you've gotten for those kids. That makes us feel good. Thank you very much.
Yeah, thank you so much.